Hello everyone. I hope you are doing well. Today I will discuss about the design and optimization of the dosage regime or regimen. What is this? To initiate the drug therapy, the clinician designs a dosage regime administered either by continuous infusion or in intervals of time and dose, depending on the various patient and drug factors, including how rapidly a steady state is achieved. The regime can be further refined or optimized to achieve maximum benefit with minimum adverse effects. Three different types of regime: continuous infusion regime, fixed dose or fixed time regime, or third one is optimization of dose. What happened in continuous regime? Its a therapy may consist of a single administration of a drug, for example, a single dose of sleep-inducing agent such as zolpidem. More commonly, however, therapy consists of continued administration of a drug either as an IV infusion or in oral dose or oral fixed dose या fixed time interval regime, for example one tablet every 4 hours, each of which results in accumulation of the drug until a steady state occurs. Steady state is the point at which the amount of the drug being administered equal the amount being eliminated, such that the plasma and the tissue levels remain constant in case of IV administration and fluctuate around a mean in the case of oral fixed dosage. Now we move towards the observation what happened in the plasma concentration of a drug following IV infusion. With continuous IV infusion, the rate of drug entry into the body is constant. In the majority of the cases, the elimination of drug is first order, that is, a constant fraction of the agent is cleared per unit of time. Therefore, the rate of drug exit from the body increases proportionately as the plasma concentration increases. Following the initiation of an IV infusion, the plasma concentration of drug rises until the rate of drug eliminated from the body precisely balances the input rate. Thus, a steady state is achieved in which the plasma concentration of the drug remain constant. Now we move towards the factor that influence the rate of drug infusion on the steady state. It can be defined as the steady state plasma concentration is directly proportional to the infusion rate. For example, in the infusion rate, if the infusion rate is double, the plasma concentration is ultimately achieved at the steady state is double. Furthermore, the steady state concentration is inversely proportional to the clearance of the drug. Thus, any factor that increases clearance, such as liver or kidney diseases, increase the steady state concentration of an infused drug. Factors that increases the clearance of the drug, such as increased metabolism, decrease the steady state concentration of an infused drug. Now we move towards the time required to reach the steady state concentration. The concentration of a drug rises from zero at the start of the infusion to its ultimate steady state level. As we can see in the graph, the fractional rate of approach to a steady state is achieved by first order process. Right, now we move towards the exponential approach to steady state, which or it's the rate constant for attainment of steady state is the rate constant for total body elimination of the drug. But it means the 50% of the final steady state concentration of the drug is observed after the time elapsed since the infusion. T is equal to the half, where T half-life is the time required for the drug concentration changes to 50%. Another half-life allows the drug concentration to approach 75% of the steady state concentration. The drug concentration is 90% of the final steady state concentration is 3.3 times half-life. Thus, a drug will reach steady state in the about 4 half-lives. Now we see the effect of the rate of drug infusion. The sole determinant of the rate that a drug approaches a steady state is the half-life, and this rate is influenced only by the factor that affect the half-life. The rate of approach to steady state is not affected by the rate of the drug infusion. Although increasing the rate of drug infusion concomitantly increases the rate at which any given concentration of the drug in the plasma is achieved, it does not influence the time required to reach the ultimate steady state concentration. This is because the steady state concentration of the drug rises directly with the infusion rate. Now we move towards how the rate of drug decline when the infusion is stopped. When the infusion is stopped, the plasma concentration of a drug declines to zero with the same time course observed in approaching the steady state. As we can see in the graph, the rate of steady state concentration is same as the rate of elimination. In the next video, I will discuss about fixed dose or fixed time regime. For more information, like and subscribe my channel. Thank you.